Hey everyone. I had a really interesting clip the other day, which I thought was a good educational case. It's a cine loop of a left ovary, but there's information in the cine loop that can be really helpful to capture, to really understand what's normal, what's abnormal. My brain is seeing lots of cues when I look at a cine loop. So I want to take you through some of those cues which are triggering my brain to raise flags for abnormal. I'm going to play the clip through a couple times first, and then we'll go through some of the nuanced findings. And I've slowed down the clip so it's playing at zero point 0.5 times the pace at which it was captured. All right, so I've played it through two times. I'm going to go back to the beginning, which is around here. There we go. And I'm going to tell you the first thing that I see. So here's the beginning of the clip. And the first thing I see is this area of mixed echogenicity. And it's got some low-level echoes, it's got some hyperchoic areas, some mixed echogenicity. And I'm going to scan through the clip. And then I get this structure that's definitely ovarian. You can see lots of follicles. So if I come back, this seems like it's outside of the ovary. Seems like it's lateral to the ovary. This is a transverse clip. And this has got a low-level echogenicity here, which looks like blood. Not an endometrioma, but if it's extra ovarian, maybe it's a hematosalpinx. And this is a fallopian tube filled with blood. So I think that that's a hematosalpinx there. Not the most classic tubular shaped with incomplete septations, but it's definitely, in my opinion, extra ovarian. Then we come to the ovary and we see at the interface between this structure here, which I think is the tube, and the ovary, all these different hyperechoic foci, which are not generally normal, although they can be present in some normal cases. When there are issues such as endometriosis, fallopian tube pathology, we can see these hyperechoic foci almost lighting up the area of abnormality. So this is exactly at the interface between the normal ovarian structure and what we were seeing before as what I think is the hematosalpinx. Now, if we come a little bit further into the clip, we see that there are several hyperechoic foci at this interface as well. And associated to this is this area of irregularity. Now, I want you to look at this regularity, irregularity, nature compared to this right here. This is smooth, this is clean, this is not. This is a vague area of irregularity associated with several hyperechoic foci. So we have the combination of these hyperechoic foci, irregular border of the ovary, and we know from what we saw at the beginning, which is coming up again just here, we have this tubular structure sitting outside the ovary. All in, to me, this is representing endometriosis with a fixed ovary at the sidewall, right there, and likely fixed fallopian tube between the ovary and the sidewall, with a collection of blood within the fallopian tube in the form of a hematosalpinx. You could confuse this with an ovarian cyst, but this to me seems like it's distinct. And hyperechoic foci can be normal, but in the context of this particular patient's clinical indication, as well as the all-encompassing findings, we think that this is endometriosis in a very subtle form.